Alcohol-related disorders are very, very common. One of the things we want to take a look at is using a code from the category Y90, evidence of alcohol involvement determined by blood alcohol level. This may be assigned when the information is documented and the patient's provider has documented something that's classifiable to code category F10 for alcohol-related disorder. Even if the provider doesn't mention it, this is one exception to the general rule in that we can use the blood alcohol level if it is documented in the patient's record, even if the provider specifically doesn't call it out in the note relating to the alcohol use, abuse, or dependence. Category F10 is the category that covers all alcohol-related disorders. These can be subdivided into with intoxication, withdrawal, alcohol-induced related disorders, and then we have three different kinds, and this is a very important point here. F10.1 is the subcategory for alcohol abuse, F10.2, alcohol dependence, and F10.9, alcohol use. Please note that abuse, dependence, and use are all mutually exclusive. One of the other things that people have an issue with is the personal history of alcohol use and wanting to use that to code alcoholism. Anytime we hear the global term alcoholism, we code that to subcategory F10.2, alcohol dependence. The fifth character that goes in the dash on this slide is the one that identifies the condition more precisely. And again, these can be further subdivided into mild, moderate, and severe. And again, you can see here each of these code categories have specific substances tied to them. In the case of alcohol, this is F10. In the case of opioids, F11, and so on. These categories that we saw on the previous slide have codes for drug abuse, drug dependence, and drug use unspecified. These are all mutually exclusive. The codes are based on provider documentation. There is no global definition for abuse, dependence, or use, or when abuse becomes dependence. Nicotine dependence is a little bit different. This is used to describe current or past use of nicotine. So anytime we see the term smoker in a note, it's coded to dependence. Dependence main term, drug, and nicotine. Tobacco use is a description of a patient's status. This is Z72.0. There is an excludes note that's included with the Z72.0 for dependence. The documentation in the record is what drives the choice of these two codes. If somebody's a former smoker, they can have a personal history of nicotine dependence, the Z87.89. And then anything that could conceivably impact a pregnancy is going to be O99.33, going back to the general rule that anything that impacts a pregnancy is coded with a code from the OB chapter. And we have substance use, abuse, and dependence. And this is a general guideline saying that only one code is used based on the following hierarchy. Think of it this way. Dependence trumps both use and abuse. And if abuse and dependence is documented, we would code only dependence. If use and abuse is documented, we'd code abuse, abuse being the most severe. And if use, abuse, and dependence are all documented, we would only use the code for dependence. So again, going back to a general rule of thumb, use is the least severe, followed by abuse, which is more severe, and then finally we have dependence. Some of the other codes that we see here for schizophrenia, schizodelusional, some of these other non-mood psychotic disorders, main term commonly is schizophrenia, and then the description of whether it's paranoid, disorganized, catatonic, what have you, would drive the rest of the code. With depression, depression would be the main term, and then the subterms would describe whether it's bipolar, manic depressive, and so on. Another main term you may want to use is disorder. For instance, this one, generalized anxiety disorder. There are other syndromes that are associated with physiological disturbances, such as anorexia, bulimia, what have you. And again, a lot of times you'll see these under the global main term of disorder. That's all I have for you. We'll see you online.